Prostate cancer is one of the most common cancers in men, but the real danger, it often starts silently. No pain, no obvious signs, just a slow build-up in the background until it's too late. That's why catching it early can be the difference between a simple treatment and a life-altering diagnosis. But here's the problem. Most men either ignore the early signs or don't recognize them for what they are. They brush off symptoms as part of getting older or something temporary. And that delay can cost them big time. This video isn't here to scare you. It's here to arm you with facts. If you catch prostate cancer early, survival rates are incredibly high. But the window for early detection doesn't stay open forever. So, knowing what to look for isn't just helpful. It could save your life or the life of someone you care about. We're breaking down 7 of the most critical early signs of prostate cancer. These are the warning signals your body might already be giving you. Subtle, often overlooked, but absolutely worth your attention. Let's get into it. Sign 1. Frequent urination. Let's start with one of the most common and most easily dismissed early signs: frequent urination. On the surface, it might not seem like a big deal. Maybe you're just drinking more water, right? Maybe it's just age. But if you're suddenly waking up multiple times a night to pee, or constantly feeling the urge to go even when you haven't had much to drink, your body might be trying to tell you something. This happens because the prostate sits just below the bladder and surrounds part of the urethra, the tube that carries urine out of the body. When the prostate starts to grow abnormally, even in the early stages of cancer, it can press against the urethra and irritate the bladder. That pressure creates the sensation of needing to urinate more often, even if your bladder isn't full. The real danger is that this symptom develops gradually. You might not notice it at first. It might just feel like a minor inconvenience, but over time it becomes more persistent. If it's happening consistently, especially at night, it's worth paying attention to, because what seems like a harmless change in bathroom habits could be one of the first warning signs of prostate cancer. Sign 2. Difficult urination. Difficulty urinating doesn't usually hit all at once. It creeps in slowly. Maybe it takes longer to start peeing. Maybe the stream is weaker than it used to be. Or maybe it stops and starts like a sputtering faucet. At first, you might chalk it up to getting older. But when the flow just isn't what it used to be, there's a reason, and it could point straight to your prostate. As the prostate enlarges, whether from cancer or other conditions like BPH, benign prostatic hyperplasia, it begins to squeeze the urethra. Think of it like stepping on a garden hose. The pressure makes it harder for urine to pass through, which is why you might feel like you have to push or strain just to get things moving. And even then, it might feel like your bladder never fully empties. This symptom is often shrugged off, but it's one of the most common signs that something's not right. If going to the bathroom feels more like a chore than a relief, or if you're spending more time in front of the toilet, wondering what's taking so long, it's time to pay attention. Difficulty urinating isn't just annoying. It could be one of your first warnings of prostate cancer. Sign 3. Blood in urine. Seeing blood where it doesn't belong is always alarming. And when it shows up in your urine, it should never be ignored. The medical term is hematuria when it's in the urine. Either way, it's a red flag. Sometimes it's visible. Your urine may look pink, red, or even brownish. Other times, the amount is so small you wouldn't notice without a lab test, but visible or not, it can be a sign that something's seriously wrong. In the context of prostate cancer, blood appears because the growing tumor can damage blood vessels in and around the prostate. It doesn't always mean cancer. There are other possible causes like infection, kidney stones, or inflammation, but it absolutely warrants a medical checkup. This symptom tends to catch people off guard because it feels sudden and dramatic, but even one occurrence should be treated as a warning. If it happens more than once, it's a serious signal your body needs help. Don't wait to see if it goes away. Blood in urine is not normal, and ignoring it could mean missing a critical early clue in detecting prostate cancer. Sign 4. Painful urination or ejaculation. Pain is your body's alarm system, and when it shows up during something as routine as urination or as intimate as ejaculation, it's time to pay attention. A sharp burning sensation while peeing or a deep, uncomfortable ache during ejaculation isn't something to brush off. It may seem like a passing infection or irritation, but when it keeps coming back or sticks around, it could be pointing to something deeper, like prostate cancer. The prostate sits at the crossroads of your urinary and reproductive systems. When cancer begins to form, it can inflame or irritate surrounding tissues, nerves, and ducts. That inflammation can lead to pain, either as a stinging burn when you go to the bathroom or a dull ache that surfaces during or after sex. It's often described as feeling like a UTI, but if antibiotics don't help or the pain recurs without a clear cause, the problem might not be infection. It might be your prostate. What makes this symptom tricky is that many men are hesitant to talk about it, but silence won't protect your health. If something feels off, especially something painful, don't ignore it. Pain during urination or ejaculation isn't just uncomfortable. It can be an early, overlooked clue that prostate cancer is developing. Sign 5. Erectile dysfunction. Erectile dysfunction is more than just a frustrating experience. It can also be a warning sign that something's wrong beneath the surface. While ED is often linked to aging, stress, or cardiovascular issues, it can also be one of the first signs of prostate cancer, especially when it appears suddenly or without a clear cause. The prostate plays a key role in sexual function. When cancer begins to grow in that area, it can interfere with the nerves and blood vessels that control erections. The result? Difficulty achieving or maintaining an erection, even in situations where arousal isn't the issue. What's more, prostate cancer can cause inflammation or structural changes in the surrounding tissue, disrupting the natural process the body relies on during sex. This is one of those signs many men don't want to talk about, let alone see a doctor for, but ignoring it doesn't make it go away. If erectile dysfunction appears out of nowhere, worsens over time, or shows up alongside other urinary or sexual symptoms, it's worth taking seriously. Because while ED can have many causes, in the context of prostate health, it could be your body trying to flag something bigger, something that needs immediate attention. Sign 6. Pelvic or lower back pain. Persistent pain in the pelvic area, lower back, or even the hips and thighs isn't just about sore muscles or aging joints. It could be something far more serious. In the context of prostate cancer, this kind of discomfort can signal that the disease is no longer confined to the prostate itself. It may have started to spread to nearby tissues or even to the bones, which is common in more advanced stages. The prostate is located deep in the pelvis, surrounded by nerves and close to the spine. When a tumor grows, it can press on nerves or invade surrounding areas, leading to chronic, often dull aches or sharp, radiating pain. Many men describe it as a deep soreness that just doesn't go away. It may worsen with movement or feel like it's coming from the lower back or hips when it's actually tied to the prostate. What makes this symptom dangerous is how easily it's dismissed. People blame poor posture, an old sports injury, or sleeping wrong. But if the pain is persistent, especially if it doesn't respond to usual remedies like rest or over-the-counter painkillers, it shouldn't be ignored. Ongoing pelvic or lower back pain, without a clear explanation, could be your body sounding the alarm about something much more serious. Sign 7. Unexplained weight loss and fatigue. Sudden weight loss without changes in diet or exercise can be a red flag. In prostate cancer, the body may burn more calories than usual as it responds to the disease, even at rest. Cancer can also interfere with how your body processes nutrients, leading to muscle loss and fatigue. Persistent tiredness, especially the kind that doesn't improve with rest, can indicate your body is under stress or fighting something internally. These symptoms are not exclusive to prostate cancer, but when paired with others on this list, they warrant medical attention. If you've been feeling drained for weeks or notice your clothes fitting looser without trying, don't dismiss it. Early diagnosis can greatly improve treatment options and outcomes, so it's important to take these signs seriously. Prostate cancer is one of the most common cancers in men, and early detection can significantly increase the chances of successful treatment. The challenge is that many early symptoms are easy to overlook or dismiss as part of aging or everyday stress, but staying aware of what your body is telling you could save your life. The 7 signs outlined, ranging from frequent urination to unexplained weight loss, aren't always caused by cancer, but they are worth investigating. Don't wait for symptoms to become severe. If you notice any persistent changes in your urinary habits, sexual function, or overall energy levels, it's important to talk to a healthcare provider. Screening tests like the PSA, prostate-specific antigen blood test, and digital rectal exams can detect problems before symptoms even appear. Regular checkups, especially for men over 50 or those with a family history of prostate cancer, are essential. Being proactive about your health isn't just about avoiding illness. It's about living with confidence and peace of mind. If you or someone you care about is experiencing any of these warning signs, don't put off getting checked. When it comes to prostate cancer, early action makes a real difference. Stay informed, listen to your body, and prioritize your health. If you found this helpful, don't forget to hit that like button and subscribe for more health insights that could save lives. Share this video with someone who might need to hear it. Early awareness can make all the difference. And if you've experienced any of these symptoms, drop a comment below or talk to your doctor. Take care of yourself, and we'll see you in the next one.